Hello, this is Dr. Bouvier with Dr. New. I've got a patient of mine here, and we're going to talk a little bit about the Smoji Effect. And he was telling me today about how he wakes up in the middle of the night, bed drenched. And go ahead and tell me your story a little bit.
Yeah, just would wake up, hot, throw the covers off, soaked, sweating, sometimes shaky, and
you were reading about something?
Yeah,
on the internet, or
well, the circadian effects and the cortisol dump that happens, and when the cortisol dumps, that your sugars rise, and that's what I thought was happening.
So, in actuality, what's happening is he's probably having that so-called Smoji effect, where he actually is getting too much insulin. He's taking 80 units of long-acting insulin twice a day, and that's a lot of insulin. So, I'm like, stop the presses. Did you check your blood sugar between 1 and 4 o'clock in the morning? And you said
no,
not yet, not yet,
not yet.
And and so this really has to be on your mind when you're treating people with insulin and stuff, that we can actually go too low, because he was getting morning blood sugars in the 300-400 range, and of course that sends another flare off. And what happens with people most of the time is they'll want to keep on increasing the dose of long-acting insulin because the morning blood sugar is jacked up, but it's jacked up because they bottom out in the middle of the night and their body responds, and the cortisol is dumped actually, but that raises your blood sugar, okay? Yeah. And it's the body's mechanism. But your friend, if your brain cells in there every time that happens, you go too low. So what I've asked him to do is cut his insulin by 50%. So he's going to take 80 once a day. He's going to check his blood sugar between 1 and 4 in the morning, and we might be able. He may even cut it down even further than 80 once a day, from 80 twice a day. So that's kind of where we're going to go with it.
Sounds good.
This is Dr. Bouvier talking about the Smoji Effect, and as a routine, I always have people check a blood sugar between 1 and 4 o'clock in the morning, or whenever their sleeping cycle is. But in the middle of their sleep cycle, check their blood sugar and see what happens. See what's going on with it as you're increasing new diabetics and even older diabetics. You've been diabetic for
over 10 years.
Over 10 years. So, not sure how long this has been going on with him, but we should be able to check that. So do check blood sugars in the middle of the night with your patients at least once a month. And when you hear that waking up in the middle of the night with jacked up blood sugars in the morning, think about the Smoji Effect. Again, this is Dr. Robert Bouvier with Dr. and You. Have a great day.